Positive coronavirus cases continues to surge in Gauteng. The province has the most active cases and is expected to emerge as the country's COVID-19 epicentre in the coming weeks. Now, authorities are advising people to adhere to social distancing and proper hygiene measures to avoid contracting the disease. But are they observing these calls? Our reporter Hasina Gori is in the densely populated Alexandra township in Johannesburg to see if people are adhering to good health and hygiene measures. Hasina, a very good morning to you. What does the new normal look like where you are?
Good morning. Well, the new normal looks a bit different to the beginning of lockdown. If you remember, Blaine, when we came here on the very first day of lockdown, almost 4 months ago, we saw those long snaking queues outside stores. We didn't see many masks and there was very little to no social distancing. COVID-19 was not really much of a reality here at that time. Many were still more concerned with ensuring that they found some way to make money or to ensure that they had food on their plates at that time. And now when we're in lockdown level 3, what we're seeing here today is something a little different. So there's not that many queues, but social distancing still not being adhered to. We are seeing masks, but there's still many that either don't wear it correctly, either under the nose or on the chin, or just don't wear it at all. We spoke to some and we got the basic kind of response that they couldn't breathe in it or they didn't feel comfortable while they had it on talking, so they would only wear it at specific times, and for most part they weren't wearing it. What we did notice is that when you look at the hawkers and the street vendors who are now being allowed to take to the streets again and once again sell, there's little to no hygiene practices, no sanitization, not even water being given to either the customer or to the seller to ensure that they are keeping themselves hygienically clean at that time. So it's still a cause for concern, and as you mentioned, those numbers are soaring. We hit over 42,000 just yesterday, and that was a 3,000 new cases spike in just one day. Really a cause for concern that if behavioral change is not made, then we might see our numbers of active cases continuing to rise.
I was just listening to a medical expert from the United States and talking about the fact that we're still waiting for a vaccine. But she was saying that this vaccine is also not going to become the magic bullet, so to speak. It is going to be part of these layers of sanitization, hand hygiene, the wearing of masks, which is so important. So I guess educating the public with regards to the realities of COVID-19 is key. Is that happening in places like Alexandra?
I don't think it's being done. Not enough is really being done. I spoke to someone earlier and I asked, you've heard people have coronavirus in the area. You've heard of schools being closed down. Has it become real for you? And the answer is still no, that people still don't understand what coronavirus is specifically, or they feel it's a theory or something that happens to other people and not really affects them per se. They still feel like, it's just something that happens somewhere else. And I think that's where education is really, really key. We saw that drive in the beginning of lockdown, where we saw officials coming out into areas such as Alex and in the Vaal and in Soweto as well, where they were handing out pamphlets, they were educating people. We haven't seen that in a while, and I feel that that is really important right now as people go out, because the thing with coronavirus is that as people move, so does the virus. And the more we move, the more chances are that we would come into contact with someone positive or we would spread. And I think that's where people really need to understand that while we were careful in lockdown level 5, we have to be even more careful now in level 3.
Something that we really need to be careful about is fear fatigue. As these numbers are going up, there's a tendency you become numb to it. And look, 6 months ago, the WHO came out and briefed the world basically about COVID-19. 6 months later, we're sitting at 10 million people that have contracted the virus. Over half 500 million people or 500,000 people have died, 500,000 people. So that's the reality on the ground, and I guess behavior changes needs to happen and needs to happen apace. Hasina Gori, thank you very much indeed for your reporting as always. Be well.